Hello, everyone. Welcome to another episode of Raya Hope, the talk show and podcast with your hosts, Raya and Leslie.
Hello. Hey, Ray Ray.
Hey, it is a beautiful Saturday
Yes,
afternoon. I don't
it
think we could have asked
is.
for a better Saturday for our scrim
I
school.
know, it's so
It's
pretty.
gorgeous.
It's gorgeous
Yes,
outside.
It is. Oh my gosh. And today's episode is dedicated to all of the wonderful medical professionals. So
Yes.
last week we dedicated it to all the nurses because
Yes.
today is May 6th. It is the beginning of Nurses Week.
Yes.
And we are celebrated until May 12th. I
Yes.
think we deserve more than a week, but we'll take the week.
Absolutely.
Thank you guys.
Absolutely.
We'll take what we can get. But it's so much more than a week. You know, we give our commitment, our dedication to this field. You know, a lot of us work early mornings, late nights. And shout out to our families, because our families are the ones that have to deal with us and
Yeah.
support us through this, nursing field, because nurses are busy.
Yeah.
Especially those in the hospital system. They're working 16 hours sometimes. We skip our bathroom breaks, we skip lunch, but thank you to our families, because a lot of times we neglect our families, and we love you guys. And a special shout out to Corey London for supporting Leslie and Taylor London.
Yes.
And shout out to my kids, Kiara and Shay, also my mother, Edwina White, and my stepmother who's listening, Kay Knight. We love you guys. But thank you for always being there and knowing that this field is not easy.
Yes.
And today we're going to be talking about nurse burnout and the future of nursing. So if you paid attention to any of the news, whether it's your local news, CNN, MSNBC, they've been talking about shortages in nursing. So before we get into the shortages in nursing, we're going to give you a little bit of background information about the beginning of nursing. And so nursing started with one nurse by the name of Florence Nightingale. She is called the founder or grandmother of modern nursing. And she was actually a statistician. So what she did was she gathered and collected data and formulated statistics. And one of those statistics was how to reduce deaths during the Crimean War, and also how to improve hygiene and living standards when it comes to disease and disease processes. So thank you, Florence Nightingale, for all of your research and for starting this foundation for us. She also started the first nursing school at St. Thomas Hospital in London.
Yeah, a lot of times, if you've ever gone to a nursing graduation, we have an oath that we take, and it comes from actually, dedicating our life to the profession. It comes from her. That's where that oath kind of comes from, her dedicating her life to, taking care of people. So, that's some good background for people that didn't know.
Well, Leslie, why don't you tell us about what exactly is nurse burnout? Because we hear it so often, but it's so much more than just being tired of a job.
Ooh. I almost feel like I'm going through it right now. And I work from home, go figure. Nurse burnout is, just feeling like it's a mental thing. Just feeling like you're just so exhausted. Actually, for me, it kind of started, to be honest, in nursing school.
Ooh, that was early.
Yeah, like going back. So my journey started as a medical assistant. My mom had lupus, and so I kind of saw early on that feeling of wanting to take care of somebody, early on with my eyes. Like, okay, this is something that I think I want to do, and taking care of my mom. When all my friends, were out clubbing and, going out having fun, from those teenage years to like early 20s, I had to go home and take care of my mom and cook, because some of the medication she was taking, she had to eat, so I didn't get a chance to really have those fun times in the latter part of my teenage years, until really, and I don't mean this in a bad way, but until like she passed away, in my early 20s. But I was thankful and grateful that I had that time with her, because you can't get that time back when somebody's gone. So That kind of steered me into the medical field at the time. I wasn't really sure that I wanted to be a nurse, but I knew I wanted to help people. So I started out as a medical assistant, and then working, I got a couple of jobs working in the hospital, in the ER, to be exact, as a secretary. And so I was in that fast-paced world, and I saw like how these nurses were moving, and I was like, I'm kind of smart like these nurses. I'm a secretary. I think I can do this. So New Orleans was kind of limited as far as nursing schools. We didn't have a lot of nursing schools. We had like 2 nursing schools. And if you know anything about New Orleans, we didn't have like a lot of opportunities. So you had like 2 nursing schools. Everybody wanted to be a nurse. And the waiting list was like 2 to 3 years to get into a nursing program. And so I found this LPN program that was like a year, and I was like, maybe I'll do that route and then just still be on the waiting list for the RN program. And so I became an LPN, and I thoroughly enjoyed it. I loved taking care of people. And then ended up here and still had a love for nursing and taking care of people. And I found a job working at a insurance company and figured I could work from home, which was something that I didn't think that nurses could do, especially as an LPN. And so I fell in love with that. But it's so funny because when you tell people you work from home, they don't realize like you can get burned out from working from home.
A lot of changes in insurance.
And it's mentally taxing depending on what area you go into working from home. So you know that because you and I work in pretty much the same area.
Utilization management. And shout out to all the UM nurses.
Please, because
that's hard.
It's very hard.
Reading cases where you'll get 15 deaths in one day.
It's mentally taxing. And that is very similar to taking care of a patient. You're just at home. And no disrespect to nurses that are on their feet 12 hours, like you said, no bathroom breaks and just up and back and forth in between patient rooms. They have that mental thing going on too with their patients, but it's working at home is mentally taxing as well, with us having to review cases too. To the point where I really feel like I am kind of getting burned out with doing what I'm doing. And I think you have to do that job to really understand where that burnout comes from. And so, just because you work in a hospital or you don't work in a hospital and you work from home doesn't necessarily mean you won't get burned out from being a nurse. Just because you're working at home, you can get burned out working at home, doing the job that you're doing at home. So that's my story.
Well, that's why we wanted to talk about this, because a lot of nurses are getting burned out and they're talking about leaving the medical field. The United States has a shortage of nurses at almost 1 million.
I can believe it.
So what are some of the reasons why we are short of nurses? Well, let me talk about the nursing and mental health aspect of it. And some of this information is from the CDC, the NIH, and beckersasc.com. So in the nursing field, textbook burnout is physical and mental exhaustion, mental distance from your job, reduced efficacy in the workplace, which means you make errors, and medical errors are one of the leading causes of deaths. Nurses are working long hours, no bathroom breaks, and nurses are suffering injuries and illness because of that. So with the mental health part, the medical field has some of the highest suicide rates in the medical field.
I can believe it.
Number 1 at the top of the list would be physicians. For every 100,000 physicians, 40 will commit suicide per year. In between 2017 and 2018, we had 729 United States nurses commit suicide.
I can believe it.
In 2022, 1 in every 18 nurses in the United States had suicidal ideation, which means they thought about committing suicide. So this is why we are bringing this to your attention, because some of these workplaces have toxic environments. There's bullying among nurses in the workplace. We have multiple tasks, and a lot of us we're working outside of our scope of practice. So that means that we have someone that's over us that would delegate, attached to us that wasn't in our scope of practice. I know LPNs are suffering from this as we speak, to where the RN or the charge nurse will say, do this job or do this wound change or do this medication, which is out of the scope of practice for LPN. So it's causing stress, a lot of stress. So what do you feel has been like your biggest mental health issue when you were a floor nurse that led you to being a desk nurse or corporate nurse?
I think for me, I'll kind of go back to my LPN days and kind of expound on the scope of practice. So each state obviously has a different scope of practice. So when I was in Louisiana, my scope of practice was I had a very wide range of things I could do.
Okay.
So I was able to hang up my own piggybacks and my own antibiotics and my own fluids. So back home, I really felt like I was a nurse. Yeah. Right? So I, had a patient, zithromycin and, normal saline, anything outside of blood, I was able to hang up and push. When I came here,
very limited.
I remember having a patient, and my patient had a ton of piggybacks that would do, and so I'm like getting in my supply room, and I have like all of these my tubings, and I got this big bag of fluids on my shoulder, and I'm like, I got my fluids and my little piggybacks, and the registered nurse looks at me and she's like, where are you going with that? And I was like, oh, I'm going to room, 1B. And she's like, oh, are you going to set that up for somebody? Like, are you going to help? Like, did another nurse ask you to grab that for them? And I was like, no, this is mine. And she's like, oh, you can't hang that. And I was like, why not? And she was like, that's not in your scope. And I'm like, are you serious? So I was so oblivious to the fact of not looking up my scope of practice. And I guess because I just figured like I came from where I did all of this, minus pushing meds and hanging up blood. And so that kind of thrust me into like, this is probably not what I want to do, because I'm used to taking care of my patient to my full capability. As a whole, and not needing to come to you and say, hey Raya, can you hang up all of these IVs? And I'll just go and get the PO meds and give that to them. You know what I'm saying? So I just decided like I didn't want to do that. I wanted to go home or find something that I felt like I could be more useful. And even though it was a switch of me working on the floor, I still felt like I was a nurse in a capacity of talking to my members, helping them work through things, because when I started out home, I was a disease management nurse. So I felt like I was more of a health coach and wellness. So I was able to walk them through like their health and go over labs, and which I was doing that when I was taking care of them in the hospital. I just removed myself from that hospital vibe, and I was doing more teaching with them, which I thoroughly enjoyed. But then when I transitioned to this utilization management, that is a different animal, it started just taking a wear on me, having to review all this stuff. And like you said, you look at these cases and you see how sick these people really are, and then I'm calling, sometimes I have to call the patients, and I'm listening to like the conversations that they're telling me that they're having with their doctors, and I'm like, did they not go over this with you? And so then you start to hear like the disparity between care, between patient and doctor, which is a whole nother animal we can get into. Because nurses are more compassionate. So then that takes a toll on you, because then that brings me back to I want to get back in the hospital so I can take care of these people, because they're not getting taken care of like they should. And then I start thinking about, oh, these poor nurses, they're probably burned out because they're exhausted you know, because they have all these different tasks, and like you said, they're working
Yeah.
out of their scope because they're getting all these extra things that they have to do on top of what they're already supposed to do, and
Right.
the patient ratio, and
It's ridiculous. It should be 1 in every 4. Right now it's between 1 in 8 to 1 in 10.
it's crazy. Like
Yeah.
this podcast should be like a 2-hour podcast
Yeah.
instead of 30 minutes.
We could talk about
because-
this all day with our own personal experiences.
Yeah, it's just it's so much. Like
Yeah.
it's just it's a lot.
Yeah.
It's a lot. Yeah, the when you were reading those statistics, I was like blown away hearing them, because I can see that. I can also understand why the suicide rate is so high, because you feel a certain responsibility of taking care of this patient
Mm-hmm.
and seeing what you see, and knowing sometimes you've done everything you can, and sometimes there's nothing you can do
Right.
with these patients, and there's nothing you can do, you know.
But also, you know, it's draining when you're in UM, because I did floor nurse and I worked at hospice and long-term care facility, skilled nursing, and that was hard.
Yeah.
So when I got to UM, I thought I was going to be able to just sit down, relax, do my work, and walk away, but I became attached
Yeah.
to the patients, and it's hard when you have a case and you have a 43-year-old patient and you're like, oh, okay, you know, do they have all the supplies that they need to go home? Do they have the DME that they need? Do they have the medication? Do they have the insurance to cover their medication? Are we going to be able to get this Schedule 4 drug?
Yeah.
And then a week later, you get a report saying this patient expired. It's mentally draining.
Yeah.
And I didn't think about that aspect of
Yeah.
it. And then also, you know, you have your other nurses that you work with. You never get to see them, but you get to type to and IM them and email them. You
Yeah.
never get to see them. And, you know, other nurses, you can build rapport with them when you're face to face in the hospital.
Yeah.
But let's get into some of these injuries with the nurses. I know a lot of nurses retire or leave the field because they are assaulted by patients. Also, there's knee injuries, back injuries from lifting patients, there's sprains, and a lot of verbal abuse from other nurses. And a lot of people won't talk about that, but this is part of the issue with nurses being burned out and walking away. So then fast forward to COVID-19, and this pandemic has added extra stress onto nurses, because now it's like, you guys are superheroes, and then when the pandemic ends, it's like, we are going to fire you guys if you don't have a vaccination. So there's just so much to it that puts so much added stress on us.
Yeah.
We're already overworked, we're underpaid, we're tired,
Yeah.
we sacrifice our own health and our families. A lot of nurses complain about feeling unappreciated. So what are some of the things that nurses can do to actually relax, go home, recuperate, get themselves together to avoid the burnout?
I want to say one thing before we get to that.
Sure.
If it's okay. One thing I think in nursing that I feel like we don't do enough of is, I feel like sometimes we don't support each other enough.
Right.
I feel like we especially new grads, I feel like sometimes we eat our prey. Kind of, I won't say who, but I'm kind of trying to mentor someone right now that's very close to me.
Okay.
Who just graduated a year ago and is ready to go part-time because they're feeling like very smart, very, very smart. Graduated from a very prestigious college, you know, was dean list, top of the class, graduated, super smart, and just feels like some days they're made to feel like they're dumb and stupid and they don't know what they're doing from nurses that they work with, and that is so far from the truth.
Yeah.
And
That's
it's
that bullying in the workplace.
and that's why. And so and they're a year into the job, and so, you know, we have to, us nurses who have been in the field for quite some time, you know, when we hear these stories, we have to be encouraging and remind these baby nurses, who have, you know, just graduated and been in the field for a minute, you know, just kind of getting their feet wet. We just have to encourage them, like, it's not you, and this is what it starts out. Unfortunately, this is what it looks like. But hang in there because we need you because of the statistics that Ray just gave, and somebody has to take care of us. Right. Somebody has to take care of people when they get sick. Right. And we as nurses just have to learn to. We all started somewhere. We all started from the bottom. I mean, even the nurses that are eating these poor babies when they come out of nursing school had to start somewhere. Yeah. So the fact
be compassionate.
That's so mind-boggling to me that you became a nurse, you know, to take care of people, but yet when you get new grads, you're like frustrated and aggravated because you feel like what, they don't know? Well, sometimes they don't.
Or if it's an RN and an LPN, you know, as an LPN, I was treated horribly because I didn't have my RN, and I was told I was not a real nurse.
Yeah, me too.
Even though I sat for the boards and had the same degree they had, no, you're not a real nurse yet.
Yeah, me too.
I'm like, what do you mean?
Me too.
I've been a medical assistant since 2004. Yeah. I have tons of experience, almost 20 years.
Yeah.
But when I was an LPN, oh no, you're not a real nurse.
And I always got a kick when, you know, I was kind of the one running circles around them and they had to come and ask me. Yeah. When I was the traveling nurse, and, you know, some things I learned back home in Louisiana, you know, because we learned like makeshift type, MacGyver type stuff back home.
Yeah, figure it out.
We did. We had to figure a lot of stuff out because we a lot of times didn't have like supplies on hand. So those RNs that I came up under, like we figured stuff out. So I took a lot of stuff and I brought it here. And so when they were like in jams, I would be like, oh, I'll be right back. And then I would come back with something. They'll be like, how did you figure? Well, how did? Don't worry about it. I got you though. You know.
Say thank you.
Exactly. You know, so
say thank you and appreciate it.
Yeah. All right. I'm sorry. I got sidetracked. Now, what's your question again? I just have to throw that out because that's so important.
I think you touched on it. I was talking about the impact of the nurses leaving the field, but like I said, the toxic work environment, you know, the bullying, we get abused, and those in mental health, you know, they're physically and verbally abused. You know, I've been kicked and punched and spat on and all kind of things working in mental health with behavioral kids and things like that. So there's a lot of abuse, and that's why I always say nursing is a calling. For sure. You have to have dedication and discipline and discernment to do this job, but you also have to know that you're covered by Yah. You know, before I would go into my mental health facilities, I would pray and I'd say, Lord, cover me with the blood. And I was serious. And then when I left the facility, I would say, thank you so much for covering me and for letting me make it through this day unharmed and unscathed, and your armor is protecting me, because it was serious. Because we're fighting more than just physical illness. We're fighting warfare, spiritual warfare. You know, demons and things are real. So nursing is definitely a calling. So nurses, if you're listening, first and foremost, please know your rights. Know your rights. Know your scope of practice, as Leslie said. If it's something that you don't feel comfortable with, if it's something that you know you're not supposed to be doing, please go to upper management and please keep track. Documentation. I can't stress it enough. And this is beyond patient care. Document your own personal work issues with your managers and supervisors that have you possibly losing your license. Document. Get rest. Ask for help when you need it. If you need help, ask for it. You know, I had a patient that was over 600 and something pounds, and they're like, well, can you go in there, change the pins, roll the patient? I said, I need 3 people to come in the room with me, and I need help. I was like 150 pounds back then. There was no way I was going to, and I knew that for myself, but you're not going to set me up to fail. So I asked for help. Ask for help. Get exercise. Keep your core strong, because your knees and your back will thank you for it. We do a lot of lifting. We do a lot of patient turning, patient transporting. And make sure you're eating well. Take your lunch breaks. Take your bathroom breaks. Make sure that you're using your PTO. Step away from that facility for a week. Go on vacation. Get your mind together. Pray, meditate, whatever you need to do. Take your personal time off, your paid time off. Make sure you're getting adequate training. If there's something you don't know how to do, don't go in there and try to fake it, because you will lose your license. Ask for proper training. Tell your provider, I'm not familiar with this. I don't have enough experience with this. Can you please get someone to help me or to teach me? Because we want you to take care of us and our family members to the best of your ability. So get the proper training. Yes.
Can I tell you, just kind of backing up on
Sure.
the PTO, please take your PTO. Jamie Foxx, and prayers up for him for whatever is going on with him. Lord knows something is obviously going on with him because it's a secret. Because nobody is really talking about it. So obviously something is going on with him.
But
And keeping with the PTO, whatever happened to him, he fell out or whatever. He's still in the hospital apparently.
Right.
2 days, they stopped recording or whatever. He was on his movie set, whatever. They stopped that day and maybe the next day.
Mm-hmm.
The following day, they got a stunt double and they went on.
They finished. Without him.
So the moral of the story, the show will go on.
Without you.
So take your PTO.
Yes.
Because if something happens,
God be
forbid,
requisition number 15783
that's all they're gonna
on
do.
the careers page.
Yeah. On Indeed.com, careers.com,
Yes.
resumebuilder.com.
Yeah.
They're gonna fill your spot.
Put yourself first.
Absolutely.
So that you're here for your family. Put your family second. But never put a job first.
Absolutely.
Don't live for your job. Live for yourself and your family.
Absolutely.
Because your job will replace you.
Absolutely.
In 24 hours. And I've seen it.
Yeah, I did. Yeah.
I was a manager.
Yeah, I had a
Post
coworker.
this requisition.
Yeah.
We're hiring.
I had a coworker who passed away.
Yeah.
And it was, that was devastating to me.
Yeah. So we're gonna get ready to close out here, but I just wanted to thank you for covering this topic with me, because I know we talk about our personal issues with our nursing and what we've been through. We've been blessed that we were able to step away from bedside care. But I just want to leave you with a Bible verse, and then Leslie's going to close you out. But also, before we go, thank you to everyone who supported our first annual Scrubs and Sneakers Ball, which is tonight. So let me leave you with this word. So the first nurse in the Bible was Phoebe. She was commissioned by St. Paul because of her charity selflessness, and she was just taking care of the sick and strangers and travelers. So Matthew 11:28-30 says, "Come to me, all of you that are weary, you nurses, and that are heavy on the burdens and carrying that load. I will give you your strength if you take my yoke and you learn from me. For I am gentle and I am humble in the heart, and you will find rest for your soul in me."
Amen.
Pray, put y'all first.
Amen.
And I'll let Leslie give you the words of encouragement.
Amen. Amen. So Leviticus 19:18 says, "Joseph was betrayed and sold into slavery by his own brothers, then falsely accused and put into prison. He could have used excuse after excuse to be bitter and angry, but he had no excuses mentally. He kept doing the right thing when the wrong thing was happening. And in the end of the day, he came out vindicated, promoted in a place of influence and respect. People may have said things about you to hurt you and offend you. Don't waste your time looking back, nursing those wounds, reliving what they did, thinking about what didn't work out, and distracting you. Let it go, and God will be a vindicator. Life is way too short. Listen to me. Life is way too short for you to waste another day in self-pity when you still have time to fix what was broken. It is not always easy to let go, but here is the key. The pain of letting go is less than the pain of holding on and missing your destiny. Just like Joseph, he chose to forgive and save his entire family."
Yes.
God bless you today. I hope you have a blessed one. Enjoy
Yes.
this beautiful weather. It is
Amen.
gorgeous.
And you can connect with us at Reyes Raise a Light _FDTN on Instagram, Reyes Raise a Light Foundation on Facebook. Email us at connect@reyesraisealight.info and visit our website at www.reyesraisealight.info. We love you guys, and thank you all of the nurses, all of the medical professionals, from the janitors up to the CEOs in the buildings that are taking care of all of our family and friends. We love you guys. Thank you so much, and y'all bless. Have a beautiful Saturday. We'll see you at the Scrubs Ball.
Bye.